Welcome back to the Rest Factor podcast. Today's guest is Dr. Heidi Gastler, a doctor of physical therapy, pelvic health specialist, and women's health educator who is changing the way we talk about menopause. With nearly 2 decades of clinical experience and her own lived experience navigating chemically induced menopause during cancer treatment, we're diving into how menopause impacts sleep, mood, intimacy, and quality of life, why so many women are dismissed when they ask for help, and what evidence-based care actually looks like during midlife. This episode is about clarity, confidence, and giving women the information they deserve. Let's dive in. Welcome, Dr. Heidi. How are you?
I'm wonderful, thank you. And thank you so much for having me. I'm very excited to be here.
Absolutely. Dr. Heidi, you spent years in clinical pelvic health before building Hey Dr. Heidi and Menopause Unscripted. What gaps in women's care pushed you to expand beyond the clinic and into education and media?
I think that a huge part for me was my own lived-in experience. I was never prepared to get diagnosed with cancer, and as a provider, I all of a sudden found myself as the patient. And although I was told that chemo would put me into menopause, I was not prepared for what that looked like. And going through that experience on my own, even with wonderful doctors and caregivers surrounding me, I found that I felt woefully unprepared for this. I also felt like in my community, I was very alone. I didn't feel like I had much community support and found myself wanting to become a voice of education for not only other women who might be feeling the same as I did, but for also a broader community than just my own here in Manhattan Beach, and wanting to kind of be a more expansive voice for women everywhere.
And what was your experience? I mean, as much as you're comfortable with sharing, what turned out to be, what were you expecting? And then what did it turn out to be like?
Sure. So I did not expect that every single symptom that we read about for going through perimenopause, that I was going to experience every single symptom. And it happened overnight. It was like I lost my cycle the minute that I started high dose chemo. So I went from having a cycle like every 27 days, like clockwork, no problem, to no cycle ever again. So it wasn't as though I had this slow, gradual decline of a cycle. It went from normal to absent. So the hot flashes in the middle of the night were one of the biggest things. And my Chilipad was my BFF. Okay. Like I can't, I love your product and I will tell everyone how much I love it. But I at 2:13 a.m. exactly every night I would wake up with a hot flash. And it was bad enough that it would wake me from sleep. I'd feel like I was having a panic attack. I would have sweat through my pajamas, and it was really a difficult experience. And that was the first thing that was really, really notable. It was those hot flashes in the middle of the night that would wake me up with the night sweats. Then it was everything else, the mood changes, the brain fog, just feeling my loss of resilience, physical injuries I had sustained like much earlier in life, all of a sudden came back to call. I had this incredible right toe pain that I couldn't do like a backward lunge because it felt like all of a sudden I had arthritis, like very severe arthritis in my right big toe. And it was just such an odd thing because I was like, I felt like I was super healthy. And, all what I tell everyone is that being healthy won't prevent cancer from coming for you. But the healthier you are, the better and more resilient you're going to be to get through it. But all of a sudden, I felt like that resiliency I'd been relying on was just gone. And so that was kind of my experience with it. Is like every symptom you read about, I was experiencing and just was not prepared for that immediate change to my body and my mental state as well.
Right. And getting hit from so many different angles. And
Yeah.
where knowledge is power, it's also kind of a curse because you think you know about it and you know that it's coming and you can explain it to patients. But then when it happens to you and you're having to mitigate the actual symptoms and be a professional and be all the things that we are in the world and show up every day, I can imagine that was challenging. Talk to me about sleep disruption Was it for you, in your case, was it because of the night sweats and that's how sleep disruption presented itself for you? I know that it's one of the most common menopause complaints, in my case, perimenopause. From your perspective, what is actually happening physiologically, and why is it just often brushed off as is just aging?
So we tend to think about, hormones for women as sex hormones, but these sex hormones really are head to toe hormones. We have estrogen receptors in every cell of our body. Same with progesterone, same with testosterone. It's really a head to toe sort of a situation. So when we are experiencing in perimenopause, this like zone of chaos, we call it, where the hormones are really in fluctuation and are no longer predictable with normal cycle regularity, we start having for perimenopausal women these surges of hormones combined with major periods of depletion. And so our body just can't kind of figure out where it is and it feels chaotic. And that affects our brain as much as it affects the rest of our body. And so for me, that kind of almost instant hormonal depletion was affecting me not just in my body, but also in my mind. And we forget this, that it is a mental thing as well as a physiological. And so much of our brain is where we sleep. And then that's how we get good, restful sleep. So having these changes in hormones and this fluctuation, say in the middle of the night, is then creating the night sweats and having that happen because it's coming from my brain that's hormonally depleted. And then we get that like night sweat and we get that middle of the night wake up. And also the nighttime anxiety, like the pre-bedtime anxiety really went up. And I'll be honest, like, I've had, anxiety all my life, but this is a lot of women. We have this kind of pre-existing like condition mentally, whether it's depression or we had postpartum, depression, we had normal depression, we have some anxiety, and this hormonal chaos will just amplify what was already there. And so we need to remember that women are not crazy and we don't become crazy because of perimenopause or menopause, but this is an amplification. And so we are feeling so much more and also have more of a loss of control of our like emotional breaks, if you will, just because our hormones are kind of all over the place and wild. So we don't have that control that we did before. And this time, especially when it's so chaotic, makes that really challenging. So one of the things I started doing is when I started HRT, as I started taking progesterone right before I went to bed because that progesterone in bedtime can really help women sleep better if they're choosing to take HRT. And that was something that I did once I started that. And for me, that was a very big difference. Taking nighttime magnesium was really helpful for me. Also, really getting on a solid kind of uh, sleep hygiene. That was the term I was looking
Yeah,
for. Sorry, the brain fog does still hit occasionally. Uh,
I get it.
but anyone watching this probably gets it. The word finding sometimes is not your best friend. But the sleep hygiene routine and really getting on that and becoming consistent was incredibly helpful. And, part of that was kind of my pre-bedtime, getting off the cell phone, which we all hear. Nighttime magnesium was helpful. Getting on the progesterone night helped a lot. Starting to wear a sleep mask, so that I was blocking out unfiltered light was helpful. And the sleep mask I particularly use also has Bluetooth headphones in it. And
Mm-hmm.
people may agree or disagree, but this is my thing, right?
Yeah, yeah.
And I've sleep trained myself to audiobooks. And some people like sound or podcast or whatever, but I listen to audiobooks to fall asleep because I realized
Yeah.
if I was like in a story for like a half an hour and then that turned off, I could kind of bypass that nighttime anxiety, get into a sleep state, and then that turned off so then I could actually just get into my sleep rhythm. And then lastly, and certainly not unimportantly, I started, I was already using a Chilipad, but I started setting a setting at 2 p.m. or I would say 2 a.m. where the temperature dropped. And so it was colder then for a period in the middle of the night. So right before that hot flash was hitting at 2:13, I was having that drop in temperature
Right.
because then that way it was helping to counterbalance that nighttime hot flash. So this I'm sure sounds really complicated to a lot of people, but having this kind of combination of factors for me became incredibly important in order to kind of set myself up for success. And then the other thing that I did, not to get too tangential here, is that I was at a conference 2 years ago. So this is a year into my journey of this sleep disruption, okay? But 2 years, so it was a year afterwards, I was at a conference, and one of the speakers there was talking about Matthew Walker's research and started talking about the 90-minute sleep cycles and how it's really important to try to give yourself these 90-minute sleep cycles to get through non-rapid eye movement and rapid eye movement cycles. And that was something I started implementing at that point. And so now I kind of think about, okay, what time do I need to be up in the morning? And then counting backwards in terms of what time do I need to be in bed at night. And so that really was the thing that kind of then pushed everything over the edge, was
Mm.
implementing that science to help what I was already doing and already knew kind of through my own information or like my own knowledge, and also in terms of like just kind of my own common sense of what works for my body.
Right, right. Um, Another guest that I interviewed was Dr. Michael Grandner, a well-known
Okay.
sleep scientist as well and researcher. And he was the one who kind of put that bug in my ear about, you have to treat it like your commute to work or you're preparing for the next day. Like, where do I have to be? What time? And what do I have to do before then in order to get there? And if you don't, you're going to get fired. There are going to be negative consequences. And I thought that is so basic, just like you said not to get too tangential about all the things that you do for sleep, but it really, I mean, it's why we do sleep training for babies, right? We look for
Right.
routines. We look for um, whether it's a warm bath and a book and the feeding and the diet. They're looking the baby sleeps best more often than not when there is a routine. So it wouldn't be any different for us. As a matter of fact, I would venture to say it's even more important for us because we have, as adults, because we have these built up anxieties through the day. We have these things we can't shut off. And then we're giving our brain the stimulus late into the night when the sun was supposed to have set in our brains as well, in our homes as well. And so all of these, the modern tech and comforts have also been destroying our sleep and our sleep habits. So um, people may see it as, oh, it's so many things, but there were things that used to be done that were done for you when you were a baby that you do for your babies, that, whatever it is to downregulate children, why would it be any different? And in fact, it probably should be even more important and more highlighted, or more effort should be put into it for adults, because we're not going to have the tantrums and the, throwing ourselves on the ground so that parents can say, oh, they're tired, they're overtired. We just keep going and we keep going and we keep going, and then throw into that a life change, and hormones are doing what they're going to do whether you want them to or not. But yeah, so going back to the HRT that you mentioned, the progesterone as one of the hormone replacements. Fear versus reality. Hormone therapy still triggers a lot of fear in a lot of people, unfortunately. In your view, has outdated messaging caused more harm than protection for women navigating menopause symptoms like insomnia and mood changes?
So I think we kind of as a community now, people who are involved in this, and I will count myself amongst that, is that we all kind of feel like women's health lost about 20 years. We had the WHI study, and some really important things came out of that. However, we now know it was a flawed study. We now know that it was very misreported. And because of that, so many women who are like our mother's age, around that, that one generation above us, they suffered unnecessarily. A lot of them were taking HRT and stopped. A lot of them never were offered it. And they were too scared to ask for it and have educated conversation. But also the education for providers in a lot of way really stopped, where we weren't getting taught about this in our education because there's too much fear. And we now have a lot more studies and a lot better studies that are coming out that really should be convincing women that not that HRT is right for every single person, but it is an available option for almost every woman. And when we're talking about HRT, we don't want to forget about topical vaginal estrogen because even for most breast cancer patients, we're talking you're on tamoxifen, we're talking you're post breast cancer, you may still be a candidate for topical vaginal estrogen because it is not systemic. And so it doesn't mean you have to take it. It doesn't mean every woman should be on it, but we should all know that it's a potential tool in our toolbox and is something that we should have educated conversations about with our providers and find out, is this right for me or not? And realize that there are other tools to use if it isn't right for you. But the fear should be gone and be replaced with conversations that are educated and empowered and realizing that this is something that should be made available to us. And if your provider is not comfortable with that, there are so many providers who are that you can have a conversation. And there are not only conversations that you can have in person, but lots and lots more virtual resources, MIDI Health being one that I refer to often. And there's a lot of other ones as well where women across the country, in the US at least, have access to this care should they so choose. I can't speak for Europe. I don't know the rules in other countries, but here in the US, this should be an open conversation at this point.
Absolutely. Let's pivot to pelvic health. Pelvic health, I feel, is rarely discussed in menopause conversations. How does pelvic floor function intersect with sleep, intimacy, confidence, and overall quality of life in midlife women?
So I'd like to go back to a word that you used a little bit ago, which is downregulation. Okay. So the nervous system is really integral with pelvic floor health. Most women assume that when they have pelvic floor problems, being it incontinence, being a huge one, when people get old, a little bit older with menopause, again, we have this potential like loss of resiliency during menopause. And one of those things has to do with the loss of collagen and elastin in our tissues. And we think about our faces all the time. And we think about, the wrinkles here and like this gets softer, but everything that's happening to your face happens to our pelvic floor and our vagina. Okay. And so with that loss of collagen and elastin, that's where we get that terrible term vaginal atrophy. Okay. We don't like to use that term very much anymore because it again sounds so fear mongering. And we talk more about like GSM, the gynecological syndrome of menopause. Okay. But that being said, that sounds really confusing too. It's just a lot of long words. Okay. But all
Well,
of the,
nobody likes the word atrophy for anything.
no, no, it sounds so terrible. And it's again, we're trying to like not use that so much anymore.
Right.
But I mention it because that's what so many people still hear. But
Mhm.
we're really using the term GSM as this collection of symptoms having to do with the vagina, the vulva, and the pelvic floor for a woman who identifies as female or who is, identifies female at birth and has those body parts. So backtracking here, that loss of collagen and elastin, that loss of that resiliency can again, kind of like me, you can have things that happen maybe during a birth, like a vaginal birth. And perhaps I had some like loss of vaginal strength after a child or a childbearing. And now in menopause, I may find that some of those symptoms are a little bit worse than they were before. Right? We may have that like loss of strength or loss of tone, but a lot of people are so amped up and keyed up. And what I'm doing with my shoulders is also what I'm doing with my pelvic floor. And I have no idea. And people don't realize that if my pelvic floor tone is super high, I'm also going to be having a lot of the bladder symptoms. I'm going to be having a lot of the pelvic pain potentially. I'm going to be having some of the incontinence. And so, one of the first things that we do in pelvic floor physical therapy is we look at someone's tone, we look at their posture, we look at how they breathe, and we look at the pelvic floor tone. And yes, this does involve a vaginal exam as long as the patient is comfortable doing that. If they aren't, we have tools externally, like external biofeedback, that we can use to get an idea of what's happening. It's not as thorough, I'm not going to lie, but we do have tools if someone says, I just can't do that. If we have somebody who's really high tone, the first thing that we need to work on is neurological down regulation. And we need to work on that because we need to get the nervous system, the breath, and the pelvic floor all coordinating. And this is a really basic example, but I think it's great for this use, especially for a visual podcast, is our bicep. Okay. Our pelvic floor muscle group is skeletal muscle, meaning that I have active mind body control over those muscles. That's different than, say, the muscles of my uterus. So, for everyone who remembers what it's like to have a cramping uterus when you have your period, you have no control over that. That's smooth muscle. Okay. I don't have control over my lining of my intestines and how that moves. That's smooth muscle. It's affected by our neurological system. And if we are upregulated and we're too a high tone, that's going to change that. But I don't have conscious mind body control over that. But my pelvic floor, I do. Okay. So I need to be able to contract it. I need to be able to relax it. I need to be able to do that rapidly. So, say I cough, sneeze, whatever, I need to be rapidly be able to recruit that muscle. And I need to be able to do it for a long period of time. But what a lot of people don't realize is I also need to be able to fully relax the pelvic floor. If someone goes to the gym, just kind of imagine this scenario, if you will. You're going to see a personal trainer, a professional who's a professional in strengthening you, and your bicep is half curled, and you go in there and they tell you, hey, listen, I'm going to have you do 100 bicep curls. You're going to think that they're crazy. Okay. That is akin to someone doing Kegels without doing a pelvic floor examination. Okay. If your pelvic floor is already half cocked, so to speak, and you're trying to do these short, tiny little Kegels, not only is that ineffective, it's also going to increase pain. So we may need to really work on neurological downregulation to get someone to be able to fully relax, fully extend that pelvic floor in order for then us to strengthen that muscle, us to get better mind body control about that muscle. But we don't know that without doing an examination. And so we
Right.
need to be able to do an exam of some sort to figure out where the tone is in that pelvic floor. Can somebody contract it? And can somebody relax it at will? And so that's really important because then we can work on these symptoms of all the pelvic floor dysfunction. We can work on pain management. We can work on the incontinence, especially the urinary stress incontinence there, okay? Which is the one where we cough, sneeze, laugh, and we leak a little bit. We
Mhm.
can work on uh, prolapse if someone has prolapse. I'm not saying we can fix it, but we can definitely reduce the symptoms and help to prevent unnecessary surgeries by helping somebody with prolapse symptoms. And if we don't know what prolapse is, just to like take a quick step, that's when we have tissue that's falling into the vaginal vault. And that could be either the uterus falling down or the bladder falling down. Again, imagine after childbirth, it was really hard, the rectum or the urethra falling again into that vaginal canal, and usually presents as a feeling of fullness or kind of pressure or rubbing inside the vagina. And so if someone's having those symptoms, please go and see your medical provider, okay? Because you need to get a proper diagnosis to know what is going on there. And pelvic floor therapy can do a lot to help those people. Now, when we start talking about nighttime incontinence, nocturia, okay, this is a different thing because my pelvic floor and the rest of my body at nighttime at sleep, we should be low tone. Our muscles should be able to relax. The problem with that is that if we have somebody who is struggling with some incontinence issues, and now the muscles around my bladder neck, and my urethra are relaxing, then we might get the nighttime bedwetting. So, for these people, a lot of things that we have to do are pre-bedtime, like modulation of activities. And one of the first things I tell people is that they need to stop drinking water about 2 hours before they go to bed and just stop drinking liquids at that point. And if you have to take nighttime pills, just a little sip of water, you're brushing your teeth, you kind of rinse your mouth and spit. But trying to stop drinking 2 hours before bed so your bladder can empty as fully as possible before we actually go to sleep. Because waking up once in the middle of the night to go to the bathroom and actually get to the toilet is considered normal, but two or more times is considered disruptive to sleep. And that's something that we don't like to see for our patients. Now, oftentimes we're working with other providers, acupuncturists or urogynecologists can provide a treatment called PTNS, which is a type of acupuncture that is not painful, but it can be used and really helpful in conjunction with pelvic floor PT and activity modulation, like the drinking water, to help with basically bladder irritation. So that's something that can be used. There are some medication that those physicians can provide. Again, a urogynecologist, not the acupuncturist, to help with this. So oftentimes with these patients, and all of these patients, these pelvic floor patients, is a combo effort. We're really creating a team around this individual. So pelvic floor therapy is part of it. And then we might have, say acupuncture, or we might have a urogynecologist if they provide that PTNS service. And then lastly, we may have somebody who is a mental health professional on this team. And we just need to recognize that the brain and the body are really intersected. And so if we need somebody who is really having a hard time with this emotional downregulation, me teaching them physical techniques might not be enough. We may also need to be having a mental health professional kind of, giving us that additional boost in care to help with these nighttime symptoms, because they do really amplify anxiety, feelings of shame, all of these things that no one wants to feel. But again, if that's upregulating us before we go to sleep, we're going to have a difficult time sleeping. But we're also going to potentially, that anxiety and being more toned up is also potentially going to ramp up the symptoms of the incontinence. So we need to truly get the mind and the body on board to help that type of a symptom, so that we are getting full and complete rest and we're not having these disruptive nighttime symptoms.
So what I'm hearing is, and it makes total sense that pelvic floor function, sleep, downregulation, addressing all of it kind of at every angle winds up ultimately, we would hope, improving confidence, then perhaps intimacy, overall quality of life. They all kind of go hand in hand. Like you said, you can't just do one without the other. For some things may work, but then if things aren't working, I guess encouraging to kind of take a multi-pronged approach. So many people that you talk to are like, well, I do all the things. And it might be all the things that they hear about. Maybe they're doing too many Kegels. Maybe they're doing them incorrectly. Maybe they're
Can't shake
causing
my
them
head
harm.
enough.
Because
Can't
you
shake
see,
my head enough.
that's what's trending online, right? So maybe
Of
they're being
course.
oversimplified or misused. That's really interesting. They're not all created equal. It's like, you don't just do a bicep curl and think that you're doing it right every time and the right way with the right amount of weight with the right number of reps at the right. So that makes all the sense in the world. If you could sit down with women in their late 30s or 40s before menopause begins, you could wave a magic wand. What do you wish they knew, especially about sleep, hormones, self-advocacy? What would that conversation look like?
The first thing that I would really encourage those women, because I do see a lot of them, and we actually have this like lovely group here in my area that we have dedicated to meeting once quarterly to discuss these things. So I do wave my magic wand like once a quarter because I get to have these conversations with a broader community. But the first thing that we really encourage women to do, and I really encourage women to do, is really work on your health now, and don't wait for these things to happen, because going into these phases, the healthier you are mentally and physically, the more resilient you're going to be to the changes. The second thing is just educating yourself. There's wonderful books, and I'm happy to give you a list if you want to post them, but there's wonderful books that are helping to educate people on a level that's very accessible, that is very understandable for the layperson. And if you go into this more educated in your 30s and kind of know what symptoms to look out for, know what symptoms to expect when that eventually happens, because it will at some point, right? When you start having those symptoms, and we always hope that they're mild for somebody, right? But we all usually have at least a symptom. And for a lot of people, it's this feeling of, I just don't feel like myself anymore. It is something that is not really even quantifiable, or even really, like, you can't really put your finger on it. It's just this feeling of, I'm changing and I don't know why. So you hit that point, and it can really happen at any moment, that that that's the time to go in and start having a conversation with your health providers to figure out a strategy to get you through this time with as much kind of grace and ease as you can, but also then on the other side, being as healthy as you can. And knowing that this hormonal transition is not as scary as we think because there is so much help. We don't want people going into this and thinking that's really scary and realizing that once you get at the other side of it, there's a few really lovely things. Okay. One, no more periods. Two, not going to get pregnant by accident. Okay. And number three is there is this innate kind of wisdom and more of a feeling of self-confidence of kind of knowing thyself and confidence for most people on the other side of this. So there are some really great things. You just kind of have to get over the hump to get there. But getting through that can be made much easier with medical care and knowing that there is help versus just trying to kind of grin and bear it, suffer through it. I think a lot of women, it's like we've kind of been taught that like suffering is just part of the program and just realizing that suffering is kind of optional and you don't have to suffer. You can get through this with more ease and grace because we have the help, we have the information out there now. And breast cancer and the cancers related to hormones are very real, legitimate fears. But realizing that even for those patients, there are still better options now for a lot of people and that there's a lot of people who are told that they weren't appropriate for this, for HRT, that it's appropriate for them. But back to your original question of like things that involve sleep and rest as well, that goes into this overall health and wellness and resiliency going into this. And whether we're talking going into perimenopause or menopause, we're talking about some other crazy health condition like I went through, going through that, if I am more well and healthy mentally and physically and can kind of like get my house in order before these things happen, it's just going to make everything easier to get through on the other side and come out more healthy and well. And rest is such a huge factor of that because we can't heal, we can't develop more muscle, we can't maintain our bone health, we certainly can't manage our hormonal health if we aren't getting adequate rest and good sleep.
That's a perfect way to kind of wrap this up, button it up. Dr. Heidi, for those that are within range of your magic wand, and for those that are not within range, where can people learn more about what they can do to be proactive, or if they're in the middle of it, right? Of these symptoms of perimenopause or menopause due to cancer, due to stage of life, or even just that are on hormone replacement therapy for whatever reason. Where can people learn more about what to do and what you're doing, what they can learn from you and how to reach out?
Absolutely. Thank you. Really anyone that is going through pregnancy, through perimenopause and into the menopause and postmenopausal period, I am more than happy to treat, consult. I also want to put out there that I do care for men who identify as transgender men who still have a uterus, still have the reproductive organs of being a female. I just want to throw out there that that is part of my care as well. And I feel like that's a population that is completely unrecognized. So underserved, unrecognized. So I just want to put that out there too, because that's a really important topic to me. Here in Los Angeles, that's a big part of our community. And I think it's really underserved worldwide. But I can be found by email. It's connect@heydrheidi.com. And that's also the same as the website. So it's heidi.com. You can reach out to me via email. You can send me a DM on social media. I am truly terrible at social media, but I have two very lovely women who work with me that keep me on track and make sure I check my DMs. So I will get back to you, but if they know they're gonna watch this and be like, yeah, that's us, not you. This is very true. But yeah, but absolutely reach out anytime. You can be found on my podcast at Menopause Unscripted. It is everywhere you can find podcasts, YouTube, and everywhere. And I love having these conversations and try really hard to have conversations like this that are at a level that everyone can resonate and understand so that the science can be made, like you said, bite size. It's like that's a perfect way to say it.
Yeah, yeah. Thank you so much, Dr. Heidi. This has been so informative and it's been such a pleasure to have you on. So I appreciate you so much.
Well, thank you for having me. I am truly a fan of Chilipad and very happy to have this conversation.
Information, inspiration, and opinions are my own and are not intended to be medical advice. Always consult a qualified healthcare provider before making any changes to your diet, exercise routine, medical treatment, or if you think you may have a sleep disorder. Conversations I have with subject matter experts are intended to continue our efforts to optimize your sleep for better health, more energy, and improved physical and cognitive performance.